Ceci. I'm going to be your student nurse. We're just going to go over a few things prior to your discharge. Just going over with you and baby, okay? So we'll start, and we'll kind of jump around, but first of all, with baby, we need to make sure he has his hat on. He's wrapped in a blanket. He's just getting, because he's going to get cold very easily. So one thing you can do to check his temperature, since we don't do in the mouth or anything, you're going to do under the armpit. So you're going to put the thermometer under the armpit, squeeze the arm to the body, just hold it till it beeps. That's about it. The normal temperature is like 97.5 to 99.3. That's what you're wanting to keep it at. Another thing is your safe sleeping. We don't want baby to co-sleep. He needs to have his own bed. So in his bed, it needs to be a crib, empty, no blankets, no pillow, toys, anything. If you want, you can swaddle him, but really only do you want one thin blanket. You have any questions?
No.
Alrighty. And when we pick baby up, baby can't hold his head himself. So when you pick it up, you're going to want to be sure you support that head, because what you can do is cause shaken baby syndrome. And you may not even mean it. It's just where the head flops a little bit too much, just kind of hurts the baby. It can have long-term effects. So just be sure you're supporting head, neck, picking him up gently. Don't shake the baby, you know. And then for a bulb syringe, when you're feeding, if you notice that he has a lot of mucus or milk left in his mouth, you can use a bulb syringe. So to use that, you're going to squeeze all the air out. You're going to put it in the side of his cheek and let it go so it suctions it out. You're going to suction it, put it onto a tissue. Same thing for the nose. Squeeze it, put it in the nose, let it go. You were going to bottle feed? Okay, perfect. So you're going to want to feed on demand for baby, but at least every 2 to 3 hours you want to try if the baby is not making the moves for it. You want to make sure you're in a comfortable position, and when you have the bottle, you're going to want to position it at an angle to where there's not air getting inside of the nipple to get into the baby, so it's not sucking on all that air. Whenever you finish, you want to sit the baby up, kind of lead him forward and pat his back just to burp him, make sure he's burped, just so he doesn't get super uncomfortable with anything sitting in there. And for you, you had C-section? Okay. So for your incision, you want to keep it clean and dry. So when you're going to clean it, mild soap with some warm water. You don't want to scrub, but you do want to get it clean. If you have a dressing, you want to keep that dressing clean. Change it once a day. It just kind of depends on the doctor if he wants to send you with the dressing. And then if you notice any signs or symptoms of infection, call the doctor. That would be redness, swelling, any itchiness, drainage. If you notice that you have a fever of 100.4, a little bit above that, come in, call your doctor, see your doctor. For your activity, you just had a baby, so you don't want to go head first into everything again. If you have kids at home, you gotta remember, kind of remind them to take it slow. You don't, You don't want to go straight into heavy lifting things. So even for baby car seat, you gotta be careful with that. You don't want to heavy lift for about the first 12 weeks. Any medications, you are going to be sent home with some pain meds for the incision. You can also get over the over-the-counter lidocaine spray, which is going to help with any soreness, any pain. And then you're going to be prescribed or advised to get a stool softener in order to help you prevent constipation, because if you get constipated, you're straining, pain, nothing fun with that. And then driving. If you're going to drive yourself, it's not advised since you had a C-section. It's going to be very painful having to sit with that seatbelt. It's going to sit right across that incision. So we suggest you have somebody drive you. And we don't really want you to drive for the first 2 weeks, if at all possible. That's about it. Do you have any questions for me?
Just one. On the bulb syringe, I will use 2 different ones, right? One for the mouth and one for the nose, or can I use the same one?
You can use the same one, just wash it, rub it off before, because you don't want to put boogers, but you would start either way, mouth to nose.
Okay.
Yes,
Thank
ma'am.
you.